I'm a third generation of dentists. So my grandfather used to babysit me in a dental office. So I saw how many patients he saw, that how many people he talked to, and a lot of people liked him, and how important he was in my eyes as a kid. That's what I observed. I saw that how he helps people. Observing as a kid all that, I decided that I want to be a dentist.
So here we go. Here we have it, Dr. Zoya. We only pronounce your first name because the last name is difficult to get over the lips. So is that okay, Dr. Zoya, that we stay with Dr. Zoya?
Yes, of course. I'll be happy to talk to you guys. It doesn't matter how you call me. My name is Dr. Zoya Yadgar, but today I'll be just Dr. Zoya.
Great. And Dr. Zoya, you have a dental practice. You're a dentist. You're a general practitioner who does a lots of things, however. And you are in the beautiful Long Island, but more closer to the city, more closer to Queens than all the way up on the thing in the city Lynbrook, correct?
Yes, we are in South Shore, Long Island, very close, located to Queens, like 10, 15 minutes from Queens, about 30 minutes from Manhattan. But Long Island Railroad, also Brooklyn, it's 30, 40 minutes away. So it's New Jersey is 50 minutes away.
Around
We,
one.
we have a lot of patients traveling from all over, especially with new trend. Some patients coming back and forth from Florida.
Right. Okay. It's around the corner. I mean, why not step by on the way home or on the way to a small little vacation to the Hamptons and get your dentistry down, go to the Hamptons, relax a little bit,
Yeah,
and go home, right?
that's the plan.
Okay. So, um, Dr. Soya, what it's always interesting to people to a to a certain degree with something so personal as medicine, dentistry. You fiddle around in our mouth. What made you wanting to become a dentist? How did this all happen and come about?
I would tell you, I'm a third generation dentist. So my grandfather used to babysit me in a dental office. So as a kid, like I didn't understand anything at the point, but the smell of the dental office, I like that my grandfather used to use so many different instruments, and uh, sitting and playing with him, I saw how many patients he saw, that how many people he talked to, and a lot of people liked him, and how important he was in my eyes as a kid. That's what I observed. And I guess the energy that was surrounding dental office, I loved it. And I saw that how he helps people. On another side, not only he helped people, he had a very good uh, comfortable lifestyle, because I'm coming from family where all kind of doctors, anesthesiologists, medical doctors, ophthalmologists, and cardiologists, and OBGYN. So among all other medical professionals, my grandfather had a normal schedule. So he had habits. He was a doctor. He had both worlds, I would say. So he had comfortable life, he helped people, and he had personal time. However, other medical professionals in my family, they used to work day and night shift, and all other stuff. So they never had enough time for family, enough time for all kind of
Sure.
hobbies. So after that, I decided that I want to be a dentist, and also I would say then it was my uncle was a dentist, but he was oral surgeon, oral maxillary surgeon. Then another uncle is periodontist. So basically, it runs in the family, in my DNA. But I decided, as a female doctor, I combine both worlds. So I want to have a family, and I have a family. Thank God, I have three kids, and I have time for my kids. I have time for my family, and I dearly love my profession. I I do difference in my patient's life. I change their smile. I change their life. I give them confidence. And I love what I'm doing. I am in dentistry. The difference between dentistry and medicine, in dentistry, you see instantaneous result. Like a person comes with no teeth, and a few weeks later, beautiful, Hollywood smile, and it's a different person. It's 10 years younger person, happier, more playful. People get married after that. People get another job. You're changing life, really. So that's what I love, instantaneous effect of dentistry. Like in medicine, like how you can treat diabetes. It's a little bit off numbers,
Like,
lower
yeah.
numbers, but it's chronic disease. You constantly dealing. There is no end result of
Yeah, I
that.
got it. This is an incredible story. I heard many stories, not the one where like, the grandfather, which in most cases with us, the grandfather is the hero. You mean he usually has a little more time for us than the papa. Is whatever. And he's a little bit. He doesn't yell so much. Blah blah blah. And then having that grandfather taking you to the job and doing things and you liking it and you seeing. And it's amazing that as a child, you picked up that he is helping people and what you actually said instantaneously. You go in and you go out. You're like, when you go away, do a high degree. Well, it's like, oh, wow. You understand?
Yeah.
And this is very, very incredible. And, you said your grandfather had a more organized, predictable life than other doctors. And I might want to point out, not that you don't know it, but to maybe people watching this video, dentistry is the most predictable part of medicine. You know, I mean, there isn't a doctor who can promise you your blood pressure will go down. There's no doctor who can, whatever it is, you can say in 5 hours you're gonna look great. You can actually
Yes.
say that. You know what I mean?
Yes.
You know,
Yeah.
in 1 hour, your toothache is going to be gone. You can say that. You
Yes.
understand? Other people can't do that.
In our practice, in 5 hours, we can change your smile, definitely. We can erase some wrinkles. We can improve periodontal disease and stop you from snoring. That's how efficient and effective we are.